Colby, thank you so much for taking the time with me today. I'm really looking forward to learning more about Pear Suite. Let's just start high level with the challenge. Tell me what was broken in healthcare that really inspired you to start this company.
Absolutely, thanks for having us. The healthcare system is very challenging in itself, but a lot of the efforts and initiatives right now aren't driven around the social drivers of health. Things around food access, transportation, social connections, all things we know that matters most to older adults and people in general, and aren't being addressed by the clinical system.
Yeah. Social determinants of health has become a buzzword, a buzz phrase, and often kind of is taken at the macro level. So let's take it down. When you think about these challenges, are there specific patients that you think of or situations that are more personal to you?
Yeah, so my background is actually in older adult care.
Okay.
I used to run a senior living facility. I used to see older adults every single day.
Wow.
I saw the challenges that they're facing: food access, social connections, not having purpose in life, not being able to get to their doctor's appointment on time because they didn't have transportation or a support network to help them get there. And so we're trying to simplify those social drivers of health, find solutions for them, and we have a SaaS platform to do that.
How long did you work in that field before making this leap?
Absolutely. 5 years. I did everything from activity director, worked my way up to administrator, and oversaw 80 staff supporting 150 older adults.
So there's plenty of people who work in those environments and see these challenges, but you made this leap to entrepreneurship. It's a risky move to start a startup. So what was it that really lit that spark?
Yeah, sure. There's a lot of interesting movements these days. People are getting older. People are going toward telehealth and more digital applications, and more older adults are staying at home. They want to live at home, age in place, and live gracefully and be independent.
Yeah.
And so there's definitely a need for more solutions to help older adults live in their homes and age in place. And we want to be that solution to help connect the providers with the community organizations that are doing this work in the field.
And you said, I can be the one to address this, I can build the team and the product. So Pear Suite, tell us what the product is.
Absolutely. So Pear Suite is a SaaS platform. We essentially build a platform making anyone a care navigator. Anyone can jump on the platform through AI-powered smart scripting, actionable dashboards, and goal setting. We can actually help an older adult through phone and text messaging. So we guide them toward their solutions, determining what their strengths and challenges are in the healthcare system around those social drivers of health.
Interesting. Okay, so anyone can become a care navigator. I think that's a really cool idea. So if I am helping my grandmother, I get on the platform. What are some of my options for being her navigator?
Absolutely. So we don't have an end user as a family member.
Okay.
Right now we're working with providers,
Any provider
plans.
can become a care navigator.
Correct.
Got it.
Even a community organization. So essentially, I guess someone could be a care navigator as a family member,
Okay.
helping organizations with their utilizing and really upskilling those members of the community that maybe aren't clinically trained, they aren't social workers, aren't case managers, but they can have the skills and they have the connections to people that can really make a difference. Think
Okay.
about a community health worker, someone who really comes from the community, maybe speaks their language, can really be empowered to do this work without the training of a social worker case manager.
Okay, so break down this dashboard concept for us. Are we talking about scheduling doctor's appointments? You also mentioned social isolation. How do some of these other maybe less tangible pieces fit into a care journey?
Sure. So one of the biggest problems in our healthcare system is they don't understand the social drivers of health and how they're affecting each individual member. Not everyone's the same. Everyone has different challenges, especially in the healthcare system. So we first start with a comprehensive assessment to understand what the strengths, challenges, needs, and opportunities of each older adult, and we use that to drive our work. Certainly, as much as need is important, interest is just as important. So we ask each older adult, are you interested in improving your food access? Are you interested in increasing your social connectivity with people? And based on that, we develop goals with them and help them toward those goals. It could be as simple as helping them get on SNAP benefits, helping them use those SNAP benefits, or getting them connected to a Meals on Wheels provider, or even getting them connected to the internet with broadband use.
One of the trends I find most fascinating is when the greatest innovation is really kind of an old school idea, like helping people set goals. And yet technology can enable these classic concepts and can drive them forward.
Yeah, it's interesting. A lot of companies are going toward tech solutions, and we believe simple as phone calls can make a big difference.
Yes.
Older adults love trusted voices. They want to talk to a robot. They want to talk to a human being.
Yeah.
And so we enable more people to be connected to these older adults and guide them and be their care coach, basically, to help them toward their goals. And it's really effective.
I would say one of the trends I'm seeing is simplicity, is finding ways to break down those barriers to access and not necessarily emphasizing the technology bit, but emphasizing access.
Absolutely. So we're expanding capacity of an organization to increase engagement, to reduce healthcare costs, to drive up health outcomes, and make people more independent through this technology, but going through a very simple method. So our tagline is actually social drivers of health simplified.
Simplified. Okay. So where are you at in the development of the company?
Absolutely. So we launched last year in the height of the pandemic.
Okay.
We saw that there was lots of need in this area. We decided to utilize community health workers and even students, and I've been able to get 13 enterprise clients now, reaching about 7,000 people every month.
Wow. And what does 2022 look like for you?
Absolutely. So we actually, focused on one market first and expanded. Now we're actually going to multiple geographic markets. We're actually doing some work in the Medicaid population as well. Another population that's really needy and needs a lot of support and hand-holding. And so we're growing every month. We're bringing on 2 new clients this month and hope to expand to hit a larger MRR and a larger geographic reach as well.
That's impressive growth. I've spoken to a lot of startups in this series and at this event. What do you attribute that rapid growth to?
Yeah, so there's a lot of need, obviously. The move toward value-based care in the healthcare system. A lot of community organizations are actually being brought into the healthcare system to do the hard work that healthcare providers can't do. These community groups like churches, community centers, senior centers, they're actually being looked at as these champions of doing the great work every single day.
Yeah.
And now that they're being backed by the healthcare system, we can actually better connect the work that they do with the healthcare system and the health outcomes that they want to see.
So remind me, just so I'm clear, how these organizations plug into the dashboard.
Sure. So one of our providers, as an example, is a community church. The church uses a platform and it enables their assistants and their volunteers to make calls to their older adults, do friendly check-ins, collect great data, and assist them with care linking and care navigation around different things like food access, vaccination use, getting access to different technology platforms so they can do telehealth from their home. And so this guided support system can actually enable more people to be independent and also do some friendly check-ins in case someone is in need or trouble and they actually come in and support.
What's the financial model behind that? Obviously, having a church involved in the care journey is sort of unusual financially.
Certainly. So the health plans are very interested in this. They want to enable more organizations to be their arms and legs in the community. And so we have great support from some care providers and some care plans coming in to support this work and actually bringing in partners non-traditionally. Yeah. So state agencies, community organizations, the senior centers, the community groups, even some civic organizations as well.
Does this kind of facilitate and enable more of like a value-based financial model?
That as well as like a community-based care model, right? How do we expand the team, bringing in community health workers, bringing people from the community, and then we do a PMPM monetary business plan, so per member per month. So if you have organizations like the YMCA that wants to bring in more members, they would just pay based on how much members they have on the platform and are being used in the service through their assistants.
Awesome. Colby, this sounds amazing. I'm really excited to learn more about it. I know you're just 1 year in, but you're seeing awesome growth, and so I know this is going to be a big year for you. So thanks for getting me up to speed.
Yeah, thanks for having us here, and we're excited to be part of Startup Health.
Awesome. Colby,
Thanks so
be
much.
well.